Hey Dr. Stewart, how's it going? Again, my topic is on traumatic brain injury and how it relates to anterograde amnesia as well as memory impairment. And so this idea of traumatic brain injury usually happens after an outside force impacts normal brain activity. So what this can look like is whenever you hit your head on something really hard, or when something hits your head really hard. So it's most commonly found with accidents and falls and contact sports, with the older population experiencing them in accidents and falls, but also the younger population more susceptible to contact sports as well as accidents. So while symptoms vary of traumatic brain injury, usually get a lot of memory loss as the main long-lasting effect of traumatic brain injury, which can often make daily life and decision-making much harder. Anterograde amnesia is another term that we'll talk about a lot today, and it has a lot to do with forming new memories and having trouble doing that after an injury. So how severe and how long this memory problem lasts often predicts how long it will take to recover to peak or close to normal brain function. And then in addition to anterograde amnesia, research on traumatic brain injury issues also has a lot to do with perspective memory, which is the ability to remember what you're going to do and just remembering things that you intended on doing. So it can be argued that traumatic brain injury frequently leads to significant disturbances across multiple memory systems, particularly anterograde amnesia and perspective memory, due to wide damage affecting core cognitive processes like attention, executive control, and fundamental ability to consolidate memories and new information. So going back to this term of anterograde amnesia, it just means that a person cannot make new memories after a brain injury. And this kind of memory loss is common and often serious in moderate and severe traumatic brain injury cases. And what causes it is whenever there's traumatic brain injury, whenever those happen, it does damage to memory systems in the medial temporal lobe, such as your amygdala and your hippocampus, and then as well as doing damage to axon connections that connect memory areas to the rest of the brain. And whenever that happens, your brain basically loses a save button. So whenever you're bringing in new information and new events or new names or anything like that, your brain has taken damage to those areas which act as a save button, and you are able to learn those things. So you're not able to learn those things whenever they take damage. So the link between a person's memory problems and their long-term recovery is very, very much shown in the post-traumatic amnesia stage. So the total time a person spends in a confused state or it's extremely important because it tells you a lot about how much functional damage they took and the brain has suffered from. Because of this, PTA or post-traumatic amnesia, again, the duration of that is definitely a main way that clinicians are able to predict a person's future as far as disabilities. In the research that I did, I found a researcher who came up with some pretty clear guidelines to what that would look like. They said if these PTA symptoms last 7 days or less, then you usually have a pretty good chance of recovery. But if it lasts longer than 42 days, then you're looking at a very high chance of long-term disability in those memory-making functions. And so there's definitely that gray area of 7 to 42 where outcomes are much less certain for individuals. And while measuring the duration of PTA can be tricky, doctors have medications that can make it last longer, which give them more time to gather results and come up with better probabilities of what a person might recover like. But it's definitely very essential to understanding traumatic brain injury severity and recovery, and it helps predict expected lengths of hospital stays and helps outlines the trajectory for a person, most practically guiding critical return to activity decisions for doctors and therapists. So while PTA durations are powerful predictors of traumatic brain injury and how complex the situation is, there's also questionnaires that could help to come to conclusion, and these questionnaires may be invalid or highly misleading, just especially in the early stages of recovery, whenever people are in an inpatient or rehabilitation setting, just because they can't remember what they're experiencing or what they're going through other than what they feel in the moment. So for example, my brother just got a concussion pretty recently and couldn't really remember anything that he was feeling other than he was tired and his head hurt a lot of times. And those were usually the only times that he would remember that is whenever he was feeling them in the moment. But my mom seemed to know a lot more because he would tell her just some of the symptoms he was feeling throughout the experience, and just through that she was able to kind of know more things that he was experiencing than he did. So addressing this lack of self-awareness is definitely essential for successful rehabilitation, because people who cannot recognize the full extent of their deficits are likely to adopt comprehensive strategies. They're less likely to adopt comprehensive strategies needed for optimal recovery. So as the research that I've kind of said so far clearly states, is memory impairment is definitely one of the most important and long-lasting consequences of traumatic brain injury. However, there are still some major gaps in our understanding of recovery and also just effects. And so I think it would be really just beneficial to follow high school athletes who experience concussions, and most data that I've found so far truly lacks a baseline for people who haven't yet experienced traumatic brain injury. And because of these gaps, I think there's definitely need for a long-term, carefully controlled study on young athletes or people who haven't yet experienced brain injury to gather a healthy baseline, so that they know what regular cognitive decline looks like, rather than cognitive decline with traumatic brain injury. So to address this, I'd like to propose research that would use a 3-year perspective longitudinal design to track the number of high school athletes, the highest number of high school athletes possible that the studiers think they can handle. And then basically those who participate in contacted collision sports will be the ones tested, and then half of this group will take half of them who have sustained concussions and half of them who haven't sustained concussions at the end, and those will be the ones that we compare. So the assessments, the baseline studies, will start at the beginning of the athletic season to ensure that all participants have a true baseline measurement of memory and cognitive ability. Concussed athletes will then be tested 72 hours after injury, and then followed at regular intervals of 1 month, then 6 months, then 12 months, and then just annually from there. And then controls will also follow the same schedule of those cognitive tests. And then this design makes it possible to observe how many memory changes over time and how repeated injuries may alter data. A lot of the tests that they'll be performing are tests like the Ray Auditory Verbal Learning Test that was used in a study that I found in a journal by Anita Linces, who also used tests like the virtual week simulation, and then just naturalistic tasks such as having participants remember to complete specific actions at designated times, which goes back to that perspective memory that we talked about in the beginning, which would definitely just show support in memory performance. And then all these things would be used to reach a baseline. And based on the research, going back in the script, I would have to hypothesize that based on the literature, poor performance on prospective memory tasks will definitely be linked to real-world consequences such as lower academic performance and slower return to play clearance from doctors and medical professionals, knowing that just the ability to learn is affected by traumatic brain injury. So the resulting data would definitely be utilized and analyzed in statistical models that would track change in over time of both individuals and the groups, and then these analyses would allow us to examine the effects of concussions and what developmental factors are affected by, or what memory functions are affected by it. The study would aim to provide evidence that can guide clinical decisions, such as improvement of return to play policies, and then also just help schools and clinicians create better support for their young athletes recovering from TBI. And this is like pretty important to me just because of what my brother's been having to go through. So in summary, it could be argued that traumatic brain injury definitely frequently leads to significant disturbances across many memory systems, talking about that amygdala and that hippocampus again, and then just the axon connections. Particular anterograde amnesia is one of those symptoms that comes with traumatic brain injury, and then also prospective memory hardship due to widespread damage affecting core cognitive processes like attention, executive control, and fundamental ability to consolidate and retrieve new information. The research clearly shows that the memory problems, especially anterograde amnesia and difficulties with prospective memory, are common after brain injury, and then they're central to how well we recover, or how well we can find out that we'll recover and get back to daily life. So there can definitely be a lot more research on the topic to build an intervention and promote recovery for traumatic brain injury victims. So thanks for your time, Dr. Stewart. I really enjoyed this assignment and we'll have to talk more about it. Thanks.